I would like to ask your permission to use this video for educational purpose and on internet.
Yes, you may.
Tell me about your symptoms before the surgery.
The symptoms I had before my surgery were intense burning in the middle low back, buttocks area, and numbness and no feeling down my right leg.
Can you show me where that problem in the right leg was?
It was here, back here, my calf and my foot, and intense pressure in my foot.
How long did you have those symptoms?
Prior to the surgery, I had those symptoms for a little over a year. It was started at the end of July, and then I had my surgery in 22, in November of 22.
So we are about 4 months, 4 months after the surgery.
It's about 3.5 months now since my surgery, yes.
Now, the pain intensity, 1 to 10, how bad was it?
It was up to 8, between an 8 and 9.
Okay. Now, let's go one by one through all those symptoms.
Okay.
The back pain, how is it now?
It's good. I have no pain in the morning when I wake up. The only time I have pain is if I'm sitting in the car for longer than an hour, so I try to shorten my trips. And I do have pain in my back if I'm walking. I tend to make sure that if I do go shopping, I make sure I always get a cart, so I have something to hang on to. And I just take my time.
Did that brace help you initially?
Yes, it did. Initially, it did help me. I did, at the 3-month mark, wean myself off of it because it was causing more pain to wear it than it did when I had it off. And I was able to just walk around the house and everything. I did tend to wear it outside always because I have fallen on the ice before a couple of times, and I have fallen in other places, mostly tripping on my own feet.
Yeah, but obviously every fall is going to set back the healing process.
Right.
But your activity of daily living, so how is it that these days?
The activity of daily living is pretty good. I have finally graduated to be able to make my beds now because that was a struggle before. So I've been able to make my beds. I can do the vacuuming. I don't lift anything too heavy yet. I usually make my husband carry longer baskets up the stairs.
That's good because we told you not to do that, right?
You did tell me not to do that. I do miss being able to hold my granddaughter, but she's walking now, so that's better. So
the leg symptoms, how are they now?
The leg symptoms, I still have. If I sit too long or if I walk too long, I start getting the numbness in my leg again.
Okay, compared to before the surgery.
Huh?
How are the leg symptoms compared to before the surgery?
I have feeling in them. I just feel numbness, a little bit of numbness that's coming back. And I don't have it in the morning when I wake up.
Okay. So it's getting better.
It is definitely getting better.
Now, as well, let's talk about your overall kind of activity of daily living and walking and taking care of. Compare it to before the surgery. What do you notice?
Before the surgery, I was able to do those things. It's just that it caused me a lot of pain. I'm one of these people that works through the pain. I just do what has to be done.
And that's something we always say people don't do.
I know. That's what I've always done. I've always just have worked through the pain and just did what had to be done. So I still have the pain. I did have limitations after the surgery. Of course I did, because I didn't want to ruin anything that was going on with my back and the healing process. So I just went by the letter, read my instructions, made sure I didn't do any bending or twisting or any of that stuff. Yeah.
And again, we are coming back to that this is just 3.5 months after
quite
this big surgery. We did a 2-level fusion, we put 2 spacers in, we put 6 screws in, and all of that is going to take some time to heal. And you told me something that your daughter told you. What did she tell you?
She told me that I have been in a weakened state for 2 years and that it is going to take time. I'm an impatient person.
No,
and
so
I want to get back to normal. So I've been very diligent about doing my exercises 2 times a day, so much so that I started the physical therapy in January. And last week she cut me down to 1 day a week, but lets me come in and use the recumbent bike for 10 minutes each time.
No, so the reason I'm taking this testimonial is for education for my future patient, because what you described, you're not our star kind of outcome.
No,
because some of my patients, a week after the surgery, they get back on their life and never look back. But what I want to learned from this interview is that sometimes, not sometimes, quite often, this is normal. This is actually the good version, because in the bad version, you will be still struggling with lots of pain, with walking, with ambulation. This is a good version of a spinal fusion, and that for many patients, this is the healing, normal healing process. The back pain is getting better, the leg symptoms are getting better, but still certain activities, certain position provoke the pain, and that's some of the things we say, don't work through the pain. And second thing we do, BLT is not a sandwich. Bending, lifting, twisting.
Right.
Okay,
yes, and I know not to do those things.
Excellent. Any other comment? Any other question? No.
No.
Okay.
Just keep working at it, and I guess when your body says to rest, you need to rest it.
Yeah,
so.
exactly. So far, overall, happy with the result that we delivered?
Yes, very much so.
What was the main things that was bothering you before the surgery? The main thing. You had many symptoms, but what was the main thing?
The intense burning.
Pain?
It was an intense burning type pain that I had in my back and my buttocks. I mean, that was so bad that even trying to sleep at nighttime
How is it now? How is that burning?
Oh, I sleep real good now.
so that intense burning pain was
gone. It's gone.
When did that intense burning pain go away?
It was pretty much right after the surgery. I had nerve pain on this side, which we had to find different. It was surgical pain, of course. And as a nurse, I know that. And so we just had to find some different ways to help treat that. And then once that got better, everything started moving along really good.
I think this is a fantastic kind of testimonial and interview about what is the middle of the road, sometimes multi-level fusion can look like. So thank you so much.
You're welcome.
I really appreciate that, okay? You're welcome.